doing that for different reasons. News Channel 25 at 6 starts now.
Breaking news, breaking story, cracking stories. News Channel 25 at 6.
If you don't have health insurance, today's the last day to start enrolling in Obamacare before fines kick in.
News Channel 25's Meg Bonacorsi is live in the Waco newsroom. Meg, some people here in Central Texas, they're just refusing to sign up.
And there are folks who say they've tried to sign up without any luck. Some say it's too expensive, and others refuse to enroll on principle alone.
If they just lower the premium to a more affordable rate for the blue-collar community, I feel like that idea could be big and it could help us. But right now, I just feel like it's a money-hungry, charade, and I don't agree with it.
Amber Mezzacappa says it would cost her family more than $10,000 a year to be insured under Obamacare. A former supporter of the president, Mezzacappa says that's money she doesn't have, and this is not where she wants to spend it.
I realize he's still not living up to his promises, so now I don't trust him or Obamacare.
As of March 1st, about 300,000 Texans had enrolled in Obamacare. Still, 1 in 4 are uninsured. That's the highest rate in the nation. And McLennan County's Health Services Director says people in Texas face an additional hurdle since state lawmakers chose not to expand Medicaid coverage. That means Texans who make less than $14,000 a year don't qualify for Medicaid or subsidies.
Quite a few people who are, below that, who can't find work or who work part-time or who are sick and can't work. So there's a lot of people out there that are left with nothing.
And Mezzacappa says she'll have to be one of those people for now.
If you're healthy, I feel like that should be a choice, not something that should be forced upon you. We shouldn't have to be told what to do and how to do it. That is our right to choose whether we want health care or not.
The fine for not enrolling in Obamacare is $95 or 1% of a person's annual salary, whichever is higher. Reporting live in the Waco newsroom, Meg Bonacorsi, News Channel 25.
First of all, just tell me your first name and your last name.
My first and last name is Amber Mezzacappa.
Okay. And you can just look at me.
Okay. Okay.
But her first question is, why have you decided not to enroll in Obamacare?
I have decided not to enroll in Obamacare because when I've done my research on the plan, I realized that the average monthly premium payment, even on the basic level, is more than I can afford at the moment, and the out-of-pocket cost, which is over $6,000 for me and my husband, and the deductible is also over $6,000, and with also on top of the $240, $300, over $300 premium range for us on average a month is just too much. And I've also done the research on the advanced income tax health care for Obamacare, where you can go see a doctor and they'll take the payment out of your next year's income tax. Well, that's a monopoly because you're not receiving anything that you work for. You're paying for your health care, which is understandable. But if you're healthy, I feel like that should be a choice, not something that should be forced upon you. But for the people that can't afford it and they're sick, regardless is going to get paid. But I just don't feel like the premium price is reasonable for the blue-collar community, and I know he's trying to help the blue-collar community, but I just think it's hurting it more. And I voted for him, Obama, in 2008. I was 18 years old, just turned 18, fresh out of high school pretty much, and I voted for him here county-wise, and then I got voted to go to district, and I was the youngest person there, and I really rooted for him, and I believed everything that he said. But then when 4 years passed and I saw he wasn't doing what he promised, I didn't vote this time around. And I realized he's still not living up to his promises, so now I don't trust him or Obamacare, and I just feel like it's not something I agree with. I also did more research, and I'm part of the exemption where the income that we have, the health care plan that is provided for us through Obamacare, is over 8% of our annual income, because I lost my job and my husband works about 40, 50 hours a week. And we have a 3-year-old son. and the state of Texas has not opted into the state assistance for health care. So everything that I do, I pay out of pocket for: medicines, doctor appointments, things of that nature. And I just don't agree with it. That's also overpriced to me, because if I'm just seeing a doctor for one thing and they're charging me $1,000 when I didn't really do that much, I don't think that's fair. And for the illegal immigrants that come into this country and just get health care, not only are we working people and working citizens at that, I don't feel like we're getting the same treatment as they are. And if they're going to get health care at a reasonable price or possibly free, why not the people that are actually citizens working hard to get what we need to take care of our families?
Okay. And her next question is, even though you don't support it, do you think it's beneficial for some people?
I think that it could be beneficial for some people if they're in that tax bracket to where, it doesn't hurt them and they're, financially able to afford that. But in my eyes, if they're healthy, why force them to get insurance and threaten them with a penalty when this should be a constitutional right? We shouldn't have to be told what to do and how to do it. That is our right to choose whether we want health care or not.
Okay. And her last question is, Texas has the highest uninsured rate in the country. Do you have any ideas on how we should fix that?
I think that we can fix that by, I think the Obamacare is a good idea intentionally. He's trying to help the blue-collar community. We're service-based town here in Killeen and Texas, Copper's Cove, so be it. And I feel like if they lowered the prices on the premium and made it to where that we actually could afford health insurance, I think it would be great for anybody. But to make it to where it's a monopoly, to where if you go to a private insurance company outside of Obamacare, they've now raised their premiums because Obamacare advertises that it's cheaper, but it's actually not in the long run. And right now it looks like a monopoly kind of being told, that we have to. When if they just lower the premium to a more affordable rate for the blue-collar community, I feel like that idea could be big and it could help us. But right now I just feel like it's a money-hungry, charade, and I don't agree with it. If you're going to help us, but don't help us and then put a lot of restrictions and standards on what we have to do and how to do it to get the help that we need.
Okay. Great. Well, anything else you'd like to add?
No, I really hope that Obama sees this and takes, I hope he watches this. I hope that everyone sees where I'm coming from, and I'm not bashing Obamacare. I just don't think it's helping anyone. And not only am I speaking for myself, but I'm speaking for everyone in my position. And I'm paying hundreds and thousands of dollars for this, and I can't, not saying that I can't afford it, but it is hard, especially when I have to take care of my son. I don't have state assistance, and I'm not able to, my husband and I aren't able to afford if I needed chemo, which right now I'm not at that stage yet, and I thank God for it. But if we were to have to pay for chemotherapy, radiation, we wouldn't be able to afford that, and we're looking at surgery right now. And so I'm not sure what to do. I'm stuck. Like, how am I going to pay for health insurance if I can't afford it? I got laid off from my job. How am I going to pay a doctor out of pocket if I can't afford the insurance? So right now, who's going to help me? When I'm working to try to get help and I still can't get it, who's going to help me? And who's going to help someone in my position? It might not be cancer. It might be anything. My husband has back problems, but his job doesn't provide insurance. And a lot of jobs don't, because the local business owners have enough problems paying the taxes that are already overrated right now. And then when they raise minimum wage, they raise taxes, which means they raise food, groceries, etc. And so when it's just everyone's going to stay where they are financially, if in my situation, or people like me, if they don't do something about it. He said there would be a $40 plan for Obamacare. That's not true. And if it is true, me and my husband don't qualify, and that's why, we tried. And we just can't. We're exempt from that. So I don't feel like we should be penalized because we are part of the exemption list because we can't afford it right now. And I don't feel like anyone should feel like they're going to be penalized with their income tax because they chose to do something that's against their belief. And if they don't believe in it, that's their constitutional right. You can't take that from us.
So just to be clear, it's not this isn't because you belong to a certain political party or
No.
whatever, it's a personal
It's a
issue.
personal issue, and a lot of people, think I might be Democratic or Republican, but really I'm independent. I believe in what's right and wrong, and if the Democratic Party is right at times, and I feel like the the Republican Party can be right at times, but it doesn't mean I'm, either one. I feel like I think for myself, and I know what's right and wrong, and that's what I believe in. This is wrong. And we can make it right, but right now it's just all the way wrong to me, in my opinion.
Okay, good. All right, so what